New this morning, there is a major change in the recommendation for when women should get breast cancer screenings. Some medical experts now say it should happen a decade earlier than the current guidelines. Joining me now to talk about the change is Dr. Daniel Herron. He is the Director of Women's Imaging at Dignity Health. Dr. Herron, good morning. Thanks so much for being with us.
Hi, thank you for having me.
Explain why this recommendation was changed.
Well, I think the organization, the U.S. Preventive Task Force, realized that cancer occurs in younger women in their 40s, and cancer is curable if you catch it early, so we need to be screening for that. So they recommended we start screening women at age 40.
And is that recommendation every year, every other year? What ultimately is it that you're telling your patients?
Well, we tell our patients, we know everybody agrees the most lives will be saved if women are willing to do it every year. Those particular guidelines recommend every other year, and they had reasons for doing that. But a lot of other professional organizations that are expert in helping women survive breast cancer, if they're willing to do it, it's better to do it once a year.
Dr. Herron, I know you're, not on the insurance side of this, but I do have to ask, you talk about these changing recommendations, and we know that a lot of, right now, depending on the insurance plan, a lot of preventive, care and, procedures are covered. How will that change with this new recommendation? Meaning, if a woman wants to have a mammogram once a year, do you believe that'll be covered, or will she have to, have that conversation with her company?
It's a great question. This particular organization reports to Congress, and their recommendations are supposed to be followed by, like, the Affordable Care Act. Fortunately, though, there's been a moratorium on that because of outcry from women, actually. So I believe most insurance companies in California, elsewhere, will still allow women to get their mammogram once a year if they choose to do that, and starting at 40, and it should be covered under the screening guidelines. So I'm optimistic that that's still available to women.
Sure, but definitely, of course, for folks at home that are watching, make sure you do check with your company for sure. Talk about the difference, though, that these recommendations could make when it comes to survival rates.
Well, we know that women that get regular screening mammograms can potentially lower their chance of dying from breast cancer by about 50%. And screening, about 1 in 4 white women get cancer before age 50. It's actually 1 in 3 of Black and Hispanic and Asian women. So I'm optimistic that if women choose to get screened earlier in their life, in their 40s, that it'll have a significant help in finding breast cancer early, when they can be cured and have less surgery, less chemotherapy, less radiation.
That preventive care is so important. Dr. Herron, we appreciate you being with us this morning and breaking that down and really explaining it for our viewers to understand. Thanks so much.